Good morning, students. How are you all? Hope you all are doing good. Okay. Uh, as your request about the cardiac conditions, I plan to start my cardiac conditions now. In order to start, you may listed some conditions that you want. In that, among that, the first one is the coronary artery disease. So today we are going to see about the coronary artery disease. Okay. So coronary artery, if you take a coronary artery, this artery which supply a blood to the muscles of the heart. So if there is any problem in this arteries or in this supply, it may lead to a furthermore conditions or most of the major conditions it will cause like angina pectoris, myocardial infarction. So like that it will be go to so many conditions which is comes lie under the basis of the coronary artery blood supply. So now we are going to see about coronary artery disease. So in that coronary artery disease, so first we are going to see about the definition. When you come to the definition, is there is any accumulation of the fat or accumulation of the fatty streaks in the coronary artery wall, what will be happening? It will be decrease the blood supply to the coronary artery through the coronary artery. So that what will be happening? It may leads to the ischemia of the cardiac muscles or cardiac tissues that may lead to the furthermore conditions. Okay, is there is any accumulation of the atherosclerosis or the in the intima of the blood vessels, in the intimal layer of the blood vessels, it may leads to the decreased blood supply and increase the demand of the blood and the oxygen in the cardiac muscles, that we call it as a coronary artery disease. Okay, so here we are having so many other names or so many other forms of coronary artery disease also. So that is a atherosclerotic heart disease, coronary atherosclerosis, coronary arteriosclerosis, acute coronary syndrome. So as you know, it may be happens due to the atherosclerosis. Atherosclerosis means deposition of fatty substance in the intimal layer of the coronary artery. It may leads to the occlusion of a blood flow. So it may cause the atherosclerotic heart disease or coronary atherosclerosis. Okay. So here, when you come to the acute coronary syndrome, So in this acute coronary syndrome, it may be happens or it may be happens due to a myocardial or complication of a myocardial infraction of a person, or it may be lead to a myocardial infraction of a person, that we call it as a acute coronary syndrome. Angina pectoris, myocardial infraction, it may happens due to the coronary artery disease, that we call it as a acute coronary syndrome. As you know about the syndrome, it is a group of disorders which is comes under. So likewise, in a coronary artery disease also, we are having so many disease that we call it as a acute coronary syndrome. Okay, so next we move on to the risk factors. We move on to the risk factors of coronary artery disease and risk factors of CAD. So when you come to the risk factors, we can divide it into two, that is modifiable risk factors and non-modifiable risk factors. So here, so modifiable risk factors and non-modifiable risk factors. When you come to the modifiable risk factors, there is a chance to reduce the risk, that we call it as a modifiable risk factors, which means what are all the risk factors which comes under the modifiable. So we can able to modify through our lifestyle modification, through our diet, through our habit, we can change that. So by the way, we can reduce the risk of coronary artery disease. Okay, so when you come to the non-modifiable risk factors, means we cannot able to change this kind of a risk factors. So it is there, it cannot be modifiable, that we call it as a non-modifiable risk factors. So first we see about the modifiable risk factors. When you come to the modifiable risk factors, we are having a increased cholesterol level, cigarette smoking, tobacco use, hypertension, lacking of estrogen in women, physical inactivity or obesity. Okay. So as you know, the increased cholesterol level. So increased cholesterol level, if it is more than 200 mg per dl, if a person, so what will be caused? So it will be deposit in the layers of the or intimal layers of the vessel. So by the way, it will be lead to a risk of occlusion of a blood flow from the part to the other part. So that's the way the person may be developed with the coronary artery disease. So next one is tobacco, cigarette smoking. So cigarette smoking, if you take a cigarette smoking, in this cigarette we are having a substance like call it as a nicotine. Call it as a nicotine. So this nicotine, what will be happening? It is easily adhere or it easily fix with the emboli or a fatty substance. It is nicotine which is easily fixed with a emboli or a fatty substance and form a plaque and it also leads to the obstruction of the blood flow. So thus the way the person is having a risk of the cessation of blood flow in the cardiac tissue or in a cardiac muscle, so that we may be developed with the coronary artery disease. So next is a tobacco use. This tobacco use also, that the chemical substance which is present in that tobacco, it may be leads to the occlusion of a blood flow. The next is a hypertension. Why the hypertension is happening? So there is obstruction and the pressure is increased in the wall and decrease in the blood supply to the particular. Pressure increase and decrease the blood supply into the particular part. It may leads to the coronary artery disease. The next is a lack of estrogen. Lack of estrogen. Why lack of estrogen come here? So estrogen, has the function to modulate the inflammatory process and improve the blood supply and prevent the formation of plaque in a woman. Understand? So it has a alpha estrogen receptor and then beta estrogen receptor. So these two receptors which will be present in the DNA of the person. Understand? So if the woman is enter into the menopausal state, or if the person is in a menopausal state, what will be happening? There is a decrease in the estrogen level. Decrease in the estrogen level. So once the decrease of estrogen level, it is a high risk of formation of plaque or formation or lead to a inflammatory response of the intimal layer of the blood vessels or intimal layer of the vascular of the heart. Understand? The estrogen which will be happening or which will be helps to prevent the inflammatory response in the vascular of the cardiac vessel, and also it is prevent the formation of plaque which is in the coronary artery. If there is any lack in that, so there will be a lack of the alpha and beta estrogen receptors. So this estrogen receptor which helps to prevent the formation of a plaque. So that what will be happening? The woman is in a higher risk of inflammatory process and higher risk of formation of plaque in the intimal layer of the blood vessel. Okay, and then physical inactivity. So physical inactivity shows that what? Due to physical activity, there is a deposition of the cholesterol or a fatty in a layer of the blood vessels. So it cannot able to ban out, it will be deposited. If the person is in a secondary life or tertiary life, what will be happening? Furthermore, deposition of the fatty streaks in the intimal layer, it may obstruct the blood flow of a person. Okay, next is obesity. Why the obesity? Due to a physical inactivity, and there will be a deposition of fat in the layers of skin as well as in the layers of the blood vessels. It will be occlude the blood flow. Understand? So what are all the risk factors which comes under the modifiable we can able to change? If the person has the high cholesterol level, what will be your advice? Your advice will be avoid the fat food and then avoid the sugar and avoid the fatty food intake and increase the fiber intake and then increase the physical activity. That's the way we can able to regulate or we can able to decrease the cholesterol level of a person. When you come to the cigarette smoking, we can able to educate them what is the causes or what is the ill effect of cigarette smoking, and if that person can stop this cessation of cigarette smoking, it will be lead to a healthy life. So due to a cessation of cigarette smoking and tobacco use, the risk will be come to a normal. And then hypertension, if the cholesterol level is decreased, the level of hypertension also will become to a normal. And the lack of estrogen, if the person is in menopausal treatment like a estrogen therapy, post menopausal estrogen therapy, if the women will be taking that, so that may be regulating the estrogen level in our body. That's the way we can prevent the inflammatory response. And physical activity, encourage the person to small physical activity or physical workout. So that's the way we can improve the physical activity and reduce the risk of formation of a fat. And then obesity, regulate the diet plan, improve the physical activity. That's the way the level of obesity will become to a normal, though we can able to reduce the risk of the coronary artery disease. So when you order all the risk factors which is comes under the modifiable, we can able to change the risk. We can able to change the risk. Okay. Next is a non-modifiable. Non-modifiable means what? That is, we cannot able to change and we can able to sustain the risk factors. So here, if the person has a family history of CAD, you take an example, if my father is a has a CAD, I am a higher most risk of the CAD, coronary artery disease. And then increasing age, when the age is increasing, if you take the incidence, it will be happen about the 40 years of a risk of a woman, and then 50 years at the risk of a male. When you come to the gender, the male is a more risk person than the female. When you come to the race, the non-white people, So these are all the non-modifiable. We cannot able to change with this risk factors. So the non-modifiable risk factor is family history of CAD, increasing age and gender and race. So that's all about the risk factors. Next we move on to the pathophysiology. Students, we move on to the pathophysiology of coronary artery disease. Okay. So when you come to the pathophysiology here, so due to the etiological factor may be a non-modifiable or a modifiable factor, and then it may be leads to the injury to the endothelial cells that lining the artery. So injury to the endothelial cells that lining the artery. So inflammation and immune reaction. Inflammation and immune reaction. So you consider that. So this is the blood vessels. This is the blood vessel. So here in this blood vessels, what will be happening? There will be a etiological factor. Etiological factor may be a high cholesterol level or a nicotine or any other conditions. Okay. So what will be doing that? It will be doing the injury to the lining. Injury to the lining. You consider that there is a formation of the lipid core in the inside the intimal layer of the this one, and then it will be leads to the inflammation and immune reaction. Inflammation and immune reaction. So that after that it is accumulation of lipids in the intima of the arterial wall. So accumulation means what? It is get accumulated like this it is get accumulated. So it is accumulated in the interior of the lining of the intimal lining of the arterial wall. So it may be into the inflammatory process like T lymphocytes and monocytes that become as a macrophages. Macrophages means engulfing. It is infiltrate the area and it is engulf the lipids and dye. So this will be leads to the proliferation of the smooth muscle. Proliferation means it is developed. The smooth muscle will be get developed. So after that there is a formation of the fibrous cap over the dead fatty core, that we call it as a erythroma. It is a formation of a fatty core. So here the fatty core will be get formed. So here it is a formation of a fatty core which is present in the fibrous cap over the dead fatty core. So that may leads to the protrusion of erythroma into the lumen of the vessel. You have seen, so this is the lumen, there will be a protrusion, there will be a protrusion, and then it get narrowing of the vessel and obstruction of the vessel. So you can see the width that is get narrowed and it will be leads to the obstruction of the blood vessels. So due to that, the lipid core cap may grow and causing rupture. So here what will be happening? It will be again it is end up with the inflammatory process. So and then it will be grow and it will be get ruptured So once it is get ruptured, so what is happening? The hemorrhage into the plaque and it is developed as a thrombus Understand? So here it is along with the plaque and along with the hemorrhage, it is developed as a thrombus. So this thrombus, what it will be do? It will be into the blood flow, So due to that, the thrombus will be obstruct the blood flow and it will be leads to the decreased blood supply. So you see, consider that this is the thrombus. It will be get obstruct the blood flow and it will be decrease the blood supply to the cardiac muscle. So that may leads to the formation of the ischemia. Ischemia means what? Increased blood supply or oxygen in that particular part, that we call it as a ischemia. So that may leads to the cardiac cell death of myocardial infarction. If we cannot able to treat a person properly, it may leads to the heart failure and death of a person. Understand? Okay. So as per the etiological factor, it may be leads to the injury to the intimal layer of the artery. So it may end into the inflammatory process or immune response. So due to the inflammatory process, there is a accumulation of fatty core in the interior layer. So it will be end up into the inflammatory process, that we call it as here. So there is a proliferation of, along with that, there is a proliferation of the smooth muscles which is present inside the layer. And it may be leads to the formation of fibrous cap-like appearance in the intimal layer. So it may be protrudes and in the of the lumen vessel. So it is caused the obstruction and the narrowing of the blood vessel. So furthermore, going of the lipid core cap and it will be get ruptured Once it is get ruptured, it is formed along with the hemorrhage which is into a plaque, it is formed as a thrombus. It get ruptured and it is formed as a thrombus. So this thrombus will be obstruct the blood flow. So due to that obstruction of the blood flow, there is a decreased blood flow to the cardiac muscle. So that may lead to the formation of ischemia and it may lead to the cardiac cell death of myocardial infarction or cause the myocardial infarction. If we cannot able to treat properly, it may end up with the heart failure and that may lead to the death of a person. So this is what happening in a coronary artery disease. For a simple cigarette smoking or a simple or a cholesterol level of a person which is get accumulate. If you take a nicotine also, already we have seen the nicotine which can able to accumulate with the fatty substance and form a thrombus. So likewise only, and then it end up into the inflammatory process and get ruptured, and then there is a release of the thrombus into the arterial vessel, and what will be happening? It is obstruct the blood flow. So thus the way there is no blood supply to the cardiac muscles. So that may leads to the myocardial infarction and which is leads to the death of a person. So that's all about the pathophysiology of the coronary artery disease. Okay students, we'll move on to the signs and symptoms. Clinical manifestation of coronary artery disease. When you come to the clinical manifestation in the cardiovascular system, what are the symptoms we can see if the person is affected with a coronary artery disease? The first one is angina pectoris. Angina pectoris means what? It is a pain. It is a pain which is present in the heart, purely in the heart, that we call it as a angina pectoris. So it may happen due to the decreased blood supply to the myocardium of the heart. So the person may be developed with the angina pectoris. The next is ischemia. Ischemia means what? Decreased blood supply and oxygen supply to the tissues. That we call it as a ischemia. The ischemia of the heart muscles. And then decreased cardiac muscle. So due to that, what will be happening? The pump of the heart which get decreased. So the output of the heart will be get decreased. And then bradycardia, below in a heart rate, and also the tachycardia, above in a heart rate, in order to improve the pumping and improve the blood supply. The heart is doing the compensatory. And then hypertension, myocardial infarction, diaphoresis, and dysrhythmias. Dysrhythmias or dysarrhythmias means there will be changes in the electrical conductivity of the heart. So when you come to the respiratory, shortness of breath, dyspnea, pulmonary edema, chest heaviness, fatigue will be present, and there may be a decreased urinary output, nausea, vomiting, cool and clammy skin, pale appearance of the skin due to the decreased cardiac output. So these are all the common or important coronary artery disease clinical sign. Clinical sign: angina pectoris, ischemia, decreased cardiac output, diaphoresis, hypertension, bradycardia, tachycardia, myocardial infarction, dysrhythmias. When you come to the respiratory, shortness of breath, dyspnea, pulmonary edema, chest heaviness and fatigue. When you on the other symptoms like decreased urinary output, nausea, vomiting, cool and clammy skin, pale appearance of the skin. So when you come to the diagnostic studies or diagnostic evaluation of the coronary artery disease, the first and foremost, history collection. When we are doing a history collection, we have to collect the we have to find out the risk factors, modifiable and non-modifiable risk factors. The next one is physical examination. So in order to check the physical examination, in order to find out the clinical sign, we are doing the physical examination. And then lab investigations. So when you come to the lab investigations, we are doing the CBC as well as the cardiac enzymes. So if the person is affected with due to a coronary artery disease, if the person is affected with the myocardial infarctions, there will be a presentation of a cardiac enzyme. There is a troponin I, troponin T, CKMB. It is present in the blood of the person. The level will be increased in the blood of a person. So that we are doing. The next is a calcium score test. Calcium score test. So it is a non-invasive test. We are doing with a CT imaginary study. We are checking the presentation of a level of calcium which is present in the coronary artery or a coronary vessel. Why means, so the level of a calcium will increase. It tells you that there will be a risk of a presentation of a fatty or formation of a fatty substance in the vessel's wall. So in order to find out that, we are doing the calcium score test. Calcium score test means it is not an invasive method. It is a non-invasive method of a CT imaginary study. It tells you about the presentation of the level of calcium in the vessels of the coronary. So in that, with that level, we can able to find out the how is the chance of presentation or formation of the fatty substance which is in the vessel wall. Okay, the next is a stress test. Stress test, we are doing the treadmill test. So we, as you know already, we are asked the person to do a treadmill. Within the intensity, we are checking the cardiac function or electrical conductivity of the person, and how come the person can able to tolerate the intensity of the stress level. And the next one is nuclear imaging study. Nuclear imaging, it is a radiopathic study. With this study, we can able to know about the functions of the layers of the heart and then functions of the heart chambers. We can able to identify with this, and then we can able to identify the blood supply. So next is a angiography. So as you know already, angiography, otherwise call it as a cardiac catheterization. So this cardiac catheterization, we can able to know about how the block. So you might have studied in a myocardial infarction about the triple vessel disease, double vessel disease, single vessel disease. So how we are going to find out with the help of the cardiac catheterization or angiography. So we are going to find out the how many vessels which is get blocked with the fatty streaks, and what is the percentage of a blockage, and what could be a treatment, or if through the cardiac catheterization we can do a stenting procedure and we can do a plastic procedure like that. Okay. The next is a ECG, echo, chest X-ray. In an echo, we can able to find out the wall motions of the cardiac muscles and blood supply and everything. We can find out with the help of the echocardiogram. Chest X-ray, in order to find out any congestions, we can able to find out with the help of the chest X-ray. When you come to the ECG, so in this ECG, we are finding the three things. That is a downsloping ST, upsloping ST, and then horizontal ST. Okay, so when you come to the downsloping, if you see, this is the so the ST will be in a downsloping. It will call it as a downsloping ST. You can see in a ECG if the person is affected with the CAD. And upsloping means like this, ST will be present. And then horizontal means it is a horizontal ST. So this kind of a image you can get if the person is affected with the coronary artery disease. So this is the diagnostic studies of a coronary artery, that is a physical examination, history collection, lab investigations, calcium score test, stress test, nuclear imaging, angiography, ECG, echocardiogram, and then we move on to the management of coronary artery disease. So when you come to the management, we are having a three type of management, that is a pharmacological management, surgical management, and nursing management and nursing diagnosis. Okay, so when you come to the pharmacological management, so we have to administer the nitrates, beta adrenergic blockers, and then calcium channel blockers, ACE inhibitors, antihypertensive medications, opioid analgesics, thrombolytic therapy. So these are all the pharmacological management. So this nitrates, which what will be happening, it is helps to improve the blood supply into the vessels of the coronary artery, and it is helps to prevent the ischemia of a person. And then beta adrenergic blockers, it is all the atenolol, propofol, all the LOL medications, which is helps to improve the blood supply and decrease the risk of formation of fatty in the workload of the heart muscle, decrease the workload of the heart muscles, and it will helps to improve the blood supply. And the next is a calcium channel blockers. Already we have studied about the calcium score test. When the calcium level will be increased, it will be risk of a deposition of a fatty streaks. So here the calcium channel and deposition of calcium channel, which will be get blocked with the help of the calcium channel blockers, that is nifedipine kind of a drugs we are using. And then ACE inhibitors, that is a pantoprazole, everything, it is helps to decrease the workload and improve the blood supply of a person. And then antihypertensive drugs, methyl-dopa, it is helps to reduce the high level of blood pressure of a person or hypertension of a person, and then it will be helps to relax the cardiac muscle and improve the blood supply of a person. And then opioid analgesics, it is purely we are giving to reduce the pain. Morphine sulfide we are administer as an infusion to a person. And then thrombolytic therapy like a streptokinase we have to administer in order to prevent the furthermore damage, in order to dissolve the thrombus of a person. So these are the pharmacological management of a person. The next is a surgical management. In the surgical management, angioplasty, CABG, PTCA. Angioplasty, we are using a balloon tipped angioplasty like that. So what we are doing, you consider that this is the vessel which is full of fatty streaks. Understand? We are doing the cardiac catheterization. So in the tip of the cardiac, in the adjacent walls, it has a balloon. So this balloon will be inflamed and it is make a fatty streaks into the or deposit into the, or it is stuck into the walls of the vessel wall, and that's the way it is improve the blood supply. Improve the blood supply. It is a balloon tipped, and in this way also we are doing a PTCA. So we are inserting the stent in that. So stent or a mesh which is present inside the insert the vessel wall. So that's the way it will be prevent the reoccurrence of the lipid core in that particular part, and also it is helps to improve the blood supply of a person. Either it may be a stent or it may be a placement of a mesh that we are doing through the PTCA. When you come to the CABGs, in case of a fully blocked, what we are doing, we are taking up the vessel from the large arteries like a femoral artery, and then we are bypass the blood flow of a person. Understand? So that we are doing in a CABG. Okay. The next is a life management. We have to provide a health education to improve the lifestyle modification. Lifestyle modification means to do the exercise and the avoid the usage of cessation of the tobacco and smoking. Smoking cessation is very important, that we have to educate with the patient in order to prevent the CAD. And then healthy diet, low salt, low fat diet we have to encourage to a person to take, and also fiber rich diet. And then we have to administer oxygen, and then we have to place a person in a Fowler's position with the bed rest with the Fowler's position in a 30-degree angle, and then we have to improve the activity of a person and strain the heart workload of the heart, and ask the person to do a small exercises in order to improve the healthy life. And also when you come to the these are all the management of a person, those who are affected with the coronary artery disease, that we are administering nitrates, beta adrenergic blockers, calcium channel blockers, ACE inhibitors, antihypertensive drugs, opioid analgesics, and thrombolytic therapy. And surgical management, we are doing the angioplasty, CABG, PTCA. And ASIC management, lifestyle modification, healthy diet, administration of oxygen, and bed rest. And then we are educate the person to do exercise, healthy exercises. And then when you come to the nursing diagnosis, acute pain related to the decreased blood supply to the heart, and decreased cardiac output related to the, there will be a there is a loss of functions of the cardiac muscle walls. So that's all about the coronary artery disease. So today we have discussed about the definition and what may be the causes, and what are all the, how the coronary artery disease will be happening, what is the signs and symptoms, and what are all the management. Hope you understand this. Be good always. Keep learning and move forward, and be positive always. Okay, thank you girls. We will see you in the next class. Thank you. Bye bye. Take care.